A German Shepherd's bite can generate over 238 pounds of pressure per square inch. That's enough force to crush bone. And if you don't know what to do in the first 60 seconds after a bite, you could be facing permanent nerve damage, life-threatening infections, or worse. Stay with me, because what I'm about to share could literally save your life or someone you love. Hey everyone, welcome back to the channel. Today we're covering something most dog owners never want to think about, but absolutely need to know: what to do if a German Shepherd bites you or someone else. Whether you're a German Shepherd owner, trainer, or just someone who's around these powerful dogs, this information is critical. So let's dive in. First, let's talk about why German Shepherd bites are so serious. German Shepherds were bred as working dogs. They have incredibly powerful jaws, sharp teeth, and an instinct to hold and control. When they bite, they don't just nip. They can cause deep puncture wounds that damage muscles, tendons, nerves, and blood vessels. According to medical data, dog bites account for over 4.5 million incidents annually in the United States alone, and large breed dogs like German Shepherds are responsible for some of the most severe injuries. But here's the good news. If you know the right steps to take immediately after a bite, you can drastically reduce the risk of complications. So let's get into the life-saving protocol. Step 1. Separate and secure. The moment a bite happens, your first priority is safety. You need to separate the dog from the victim immediately, but do not pull away forcefully if the dog is still holding on. This can cause massive tissue damage. Instead, try these techniques. Use a loud, firm command like "No" or "out." If the dog doesn't release, try to distract them with a loud noise, water, or by covering their eyes with a jacket or blanket. Once separated, secure the dog in another room or area to prevent re-injury. Do not punish the dog right now. Focus on the victim. Step 2. Assess the wound. Now, quickly assess the severity. Ask yourself these questions. Is there active, heavy, bleeding? Can you see deep tissue, bone, or tendons? Is the wound on the face, neck, hands, or joints? If the answer to any of these is yes, call 911 immediately. These are medical emergencies. For less severe bites, you still need to act fast. Every second counts in preventing infection. Step 3. Control bleeding. If there's bleeding, apply direct pressure with a clean cloth or sterile gauze. Don't peek at the wound every few seconds. Maintain firm, constant pressure for at least 5 to 10 minutes. If blood soaks through, don't remove the cloth. Just add more layers on top and keep pressing. Elevate the injured area above the heart if possible. This reduces blood flow to the wound. If bleeding doesn't stop after 10 minutes of pressure, this is a medical emergency. Call for help. Step 4. Clean the wound. Once bleeding is under control, you need to clean the wound thoroughly. And I mean thoroughly. Rinse the bite wound under running water for at least 5 minutes. Use mild soap if available, but water is the most important part. Why is this so critical? Dog mouths contain over 60 different species of bacteria. If that bacteria gets trapped in a puncture wound, it creates the perfect environment for a serious infection called cellulitis or even sepsis. After rinsing, gently pat the area dry with a clean towel. Do not use hydrogen peroxide or alcohol directly on deep wounds, as this can damage tissue and slow healing. Step 5. Apply antibiotic ointment. Apply a thin layer of antibiotic ointment, like Neosporin, to the wound. This creates a barrier against bacteria and keeps the wound moist, which promotes healing. Then cover it with a sterile bandage or clean cloth. Step 6. Seek medical attention. Here's where people make a huge mistake. They think, "Oh, it's not that bad. I'll just watch it." No, you need to see a doctor, even for bites that seem minor. Here's why. Puncture wounds from dog teeth can be deceptively deep. What looks small on the surface might have caused significant damage underneath. A doctor will properly clean the wound, assess for nerve or tendon damage, and determine if you need stitches, antibiotics, or a tetanus shot. Most dog bite victims need antibiotics to prevent infection. In fact, studies show that around 15 to 20% of dog bites become infected without proper treatment. Even after treatment, you need to monitor the wound closely. Watch for these warning signs of infection. Increasing redness that spreads beyond the wound edges. Swelling that gets worse after 48 hours. Warmth around the wound. Pus or foul-smelling drainage. Red streaks extending from the wound. Fever over 100.4 degrees Fahrenheit. If you notice any of these symptoms, get medical help immediately. Infections from dog bites can progress rapidly and become life-threatening. Now let's talk about something scary: rabies. If the German Shepherd that bit you is not up to date on rabies vaccinations, or if it's a stray or unknown dog, you must report the bite to local animal control immediately. Rabies is almost always fatal once symptoms appear, but it's completely preventable with post-exposure treatment. Do not take chances with this. Animal control will quarantine the dog and monitor it for signs of rabies. If necessary, you'll receive a series of rabies shots. Also, document everything. Take photos of the wound, get the dog owner's information and vaccination records, and file a report with animal control. This is important for both medical and potential legal reasons. Many jurisdictions have strict liability laws for dog bites, meaning the owner is responsible regardless of the dog's history. Documentation protects you. Before we wrap up, let's quickly cover what not to do after a German Shepherd bite. Number 1. Don't ignore it. Even small bites need medical evaluation. Number 2. Don't close deep puncture wounds with stitches at home or apply superglue. This can trap bacteria inside. Number 3. Don't assume the dog is safe because it's a family pet. Any dog can carry bacteria or have rabies if not vaccinated. Number 4. Don't delay treatment. The first 24 hours are crucial for preventing complications. And number 5. Don't retaliate against the dog. Focus on medical care first. Understanding why the bite happened comes later. German Shepherds are incredible dogs. They're loyal, intelligent, and protective. But like any powerful animal, they deserve our respect and understanding. If a bite does happen, staying calm and following these steps can make the difference between a full recovery and serious complications. Remember the protocol: separate and secure, assess the wound, control bleeding, clean thoroughly, apply antibiotic ointment, and most importantly, seek medical attention. If you found this video helpful, please hit that like button and subscribe for more life-saving pet safety content. Drop a comment below if you have questions or share your own experiences. I read every single one. Stay safe out there, and I'll see you in the next video.